everybody, and welcome to another conversation with a doc. And while Teresa Dolan is not a doctor, she is a very accomplished physical therapist, and I'm going to let her introduce herself because I don't have my notes in front of me. So I'm going to let Teresa talk. She's going to talk a lot about adaptive equipment and how it can maximize your independence. And Teresa, take it away.
Hello, everyone. Thank you for inviting me to this. I'm going to correct Judy because I'm an occupational therapist, not a
Oh,
physical therapist, and
I'm
that's
sorry.
fine. Don't feel bad. So I've been working at Good Samaritan Hospital as an occupational therapist for about 27 years. I work on inpatient rehab, and I've also worked on acute care and in subacute, as well as long-term care, doing small coverage there. But my primary job has always been in inpatient rehab. And so I'm here today to explore the areas of adaptive equipment with you, so that you can become more independent with things. What you're going to see is that, first of all, I have no financial disclaimers to any of the products that I share today. I'm wish I did have money invested in some of them, but I don't. So sometimes as Parkinson's disease symptoms progress, but also just as we age, sometimes daily activities just become more difficult. So the concept tonight is really looking at exploring some resources as well as looking at ways that you can stay more independent. So, um, all adaptive equipment costs money, and so I wanted to show you some ways that you can potentially save some money. This was a focus in Maryland. So Maryland has the Maryland Technology Assistance Program, which is on Argonne Drive in Baltimore City. And they are a branch of the Maryland Department of Disabilities. And basically, what they do is they have an entire room that is filled with all sorts of adaptive equipment, from low tech to high tech. High tech meaning computer programs and computer things, to low tech, which is just things that don't have any electronic component to them. They have a loaner library, so you can borrow things from their program for up to 30 days to try it. And I think that's a great way to try some things to see what works for you. They will also, you can set up a consultation with them. So you can meet with an occupational therapist and go through, they'll ask you a series of questions and look at how your function is. And then they can make some recommendations based on that as well. The other thing they can do is, if you are interested in purchasing things, they can provide some low interest financial loans if you qualify for that. And then they also have some connections with other vendors and things that sometimes you can get things a little bit lower price. So that's one option for the Maryland area. And like I said, their program is on Argonne Drive, and James Whitney is usually the contact there, but it's easy to find online. There's also a program called Maryland Reuse Durable Equipment Reuse Program, and they have a high-tech program and a low-tech program. And what they do is they do also have an online library, but you can fill out an application online. There is a portion that you need a healthcare provider to fill out. They have a low tech versus a high tech equipment. And basically, you can sign up. So their low DME is things like commode chairs or walkers or canes or things like that. So some of us already have some of that equipment, but maybe you have a second floor and it would be nice to have a walker upstairs. This is a way that you can get free equipment. It is used, but it's free. And whatever they get in, they refurbish, they make sure it's in good working order, and then you can sign up. They have one central location, but they will ship the items to areas that are near you. It's usually in a senior center, and they will arrange for you or a caregiver to go for a pickup time. That's their low tech. Then their high end DME is things like power chairs, lifts, electronic devices like that. So that's something you can explore online, that I think is a really helpful, and I know that I've used that with my patients as well. Some of the items that are donated can be anything from adaptive computers, mice. They have speech communication devices. They have amplified telephones, gaze systems. So they have all sorts of equipment that people are no longer using. And they're based in Colombia. And then the durable medical equipment, that's the online portion that you can fill out. And really, any of this, if you connected with the Maryland Technology Assistance Program, they would be able to tell you about it. But the basic durable DME is, also includes bathroom equipment, which is an area that a lot of people need equipment for. And they also have things like bed rails. And then they have the more complex things. So if you need a mechanical lift and your insurance isn't covering it, this may be one way to get that. So now I'm going to talk about some specific pieces of adaptive equipment. I want you to think about this from very low range, so lower cost to high cost. So some of this may seem really kind of crazy, but I always think that if you dream, you should just dream big, because sometimes there are things available that you can get it. So the first thing is called the Triton Tower, and it's a water bottle that will attach to a wheelchair that has a flexible long straw so that you can move it wherever it's accessible for you. It is $60 on Amazon, and I think it's a great resource because it really does stay connected to the wheelchair, where I found other ones sometimes fall off. You can get weighted utensils. So sometimes these are nice with tremors, and they come in all different types. So this is just one set. Most of the things I'm going to point out are on Amazon. More and more adaptive equipment is really pretty easily available. Some of it's even in Target and Walmart and places like that. So you don't necessarily have to go to a specialized store for it. Some adaptive equipment comes in a nice little kit like this. What I like about that is that you can take it out in the community much more easily. So this is one that has a little kit that you can just take with you. It's got a bib on it too to catch crumbs if you need something like that. And then I really like this equipment. It's kind of underutilized. It's a weighted dining aid, and it's called the Steady Spoon. And basically, it has this weight on the one end that helps to stabilize it. But it makes it a little bit more stable, and you don't need as much movement to be able to use it, particularly with range of motion limitations. And then there are swivel utensils that are sometimes good, sometimes bad. It just depends on the person. That's why sometimes having an occupational therapist that can trial things with you is sometimes helpful if you're finding that you're having difficulty in the area, in any of these areas that we talk about. But particularly with meals, sometimes it's really trial and error that we really figure out what will work for us. I'm going to skip this one because it's no longer available. And then this is a really high end. So I know you look at that price tag at $8,625, and that's pretty outrageous. But this is for somebody who really is at the point where they can't hold a utensil and they can't be able to bring it to their mouth. So the Obi is a robotic feeder, and basically all you have to be able to do is hit a button. So the button can be, anywhere from 3 to 4 inches wide, and you click it, and it actually has two buttons that would go with it. You can use any switch actually, and it will choose which bowl you're getting it from, and then it will scoop and bring the food up to you, that you just have to do a small lean forward to be able to reach that food. So for some people, being able to enjoy a meal, sometimes our retirement doesn't go necessarily as planned, and maybe you're not able to do some of the things that you had initially planned to do, and maybe something like this is within reach. So it's definitely worth at least knowing about. When it comes to grooming, there are more and more products coming out every day. This is one that is a toothpaste dispenser. So all you have to do is put your toothbrush in the hole, and it will dispense the toothpaste right onto your toothbrush. But there are also a lot of other things. So this is one, it's called Sonic is a great way to go with toothbrushes, because you don't have to do as much of that brushing motion. And so you can still do a thorough job. This is actually a three-sided toothbrush. And then there is this one, which is a sonic brush as well, that basically you put toothpaste in three spots, you bite down on it for 30 seconds, and it will do all the cleaning for you.
Hmm.
This is a hair dryer stand. So this is, again, this is a little bit lower tech, but it's holding that hair dryer for you so that you don't have to do both motions at the same time. And then this was a shaver that actually a patient had recommended that really liked it. It's there are lots of different shavers available out there, so that's something that I would encourage people to just Google and look at. But this one was specifically recommended because it's got a smoother top to it, and they found that it was very easy to use. With dressing tasks, there's lots of adaptive options out there. So there are loops that you can add on to clothes to make it easier to pull things up. There are a lot of magnetic closures. There are also extended zipper pulls. You can have wide leg openings for these people who are struggling with dressing. The other thing with this is that there are a lot of different closures for shoes as well. So they now have magnetic closures for shoes that make them easier to get on and off. So this is called wing pants, and I know that a lot of people have used reachers before. What this does is basically you hook the pants onto this, and then you can lower them down, and it holds the pants open for you. What I've found as an occupational therapist is a lot of people struggle, even if they've got long-handled equipment, to be able to see those openings. And we know with Parkinson's that sometimes depth perception becomes an issue. So this is a viable option for those people to be able to get their legs into their pants. And again, that's called wing pants. There are a lot of different companies that are selling adaptive equipment. So anything from Tommy Hilfiger to Buck and Buck and Silverts are just a few of those companies. We're starting to see them come out more and more. This is called Magna Ready. So this is one of those magnetized shirts. So even though it looks like it's a button shirt, it literally has magnets that hold it closed. This is something that I think a lot of people, as they age with arthritis and other disorders, really struggle with those small fastenings. And so this is a great option. And then shoes, we're seeing more and more of these come out that are step-in shoes that are easily applied, and you don't really need to use like a long-handled shoehorn or anything like that. So a few of those are Skechers has a pair, the Nike Go Fly Ease, and Kizik's also has a pair. So with toileting, there are lots of different options for toileting. One thing we want to think about is how easy it is to get off of a surface. So our standard toilets are about 15 to 17 inches. If you're a taller person, that becomes harder and harder, particularly with Parkinson's. And so you can get a chair height toilet, or you can even go taller than 19 inches with the tall height. So if you have the money to get an actual toilet installed in your home, those are great things to look at as to what height works best for you. There are also things that you can add on to your toilet that are less expensive. So one thing is just to have safety rails added. The first picture that you see, you just basically have somebody take your toilet seat off. It's got a bracket that goes underneath, and you can just add the rails right to your own toilet. The one thing I don't like about those rails is that you can't pull on them. You really have to push down through them because otherwise they will pull back. You can also do the second one is an add-on, which is a raised toilet seat with rails added to it. So you can get that it locks onto your toilet. And then the third option is a commode chair, which you can have not only next to your bed, but a lot of people put it right over top of their toilet. And the nice thing about that is that the height is adjustable. And then this is a little bit more expensive option. It's called the Gentle Boost. And basically, it will actually help lift you off of the toilet. So if you're really struggling with that toilet, this might be an option. And then in terms of getting clean, a lot of people really find that bidets are much more available today as additions to your standard toilet so that you don't have to necessarily replace the full thing. They come with warm water, with heated, so that it's heated and you're not getting that cold flush. But they also come with blow dryers. So it really makes toileting, which is something a lot of people struggle with, something that you can become more independent with. So, for people who have care providers, for male, there is something called the quick change. And so, if you find that you're wearing Depends at night or you're caring for somebody who is, if they're not moving around a lot in bed, this is an option. It's called quick change. And basically, you slip it in and you're putting it over top of the penis and folding it. They show you different ways that you can fold it. And the benefit to it is if you're having to change somebody several times a night, this is a way that you can change somebody within 30 seconds. So you're just slipping it out, slipping it in. It makes it quicker for the person who's changing them, but it also disrupts less sleep. So that is an option for men. And then for women, the Pure Wick is becoming very used in hospital settings. And every patient that I've had that uses this, that has incontinence episodes at night, ends up loving this because it has a suction to it. And essentially, it sucks up the urine, so it keeps you dry throughout the night. It is expensive, so I'm not going to lie. It ranges between 500 to about almost $800. And I have found that it might be covered by Medicare. You don't I don't know how to really tell you. You have to call your insurance company to see. But they are starting to cover this. So, we know that incontinence, when we have urine on our skin, it causes skin issues. And some people end up with sores. So this is one way that you might be able to justify the need for something like this. So for cooking in the kitchen, the first thing is we always want to think about safety. So sometimes just having a cut resistant glove is a really good, safe option for people, and a simple way to make things safer. You can also there are lots of different chopping things out, to help you with chopping and cutting, which is going to simplify things. Even people without problems are starting to use these because it makes things faster and efficient. And then there are things like the kettle tipper. The nice thing about this, and they have these you can get these. This is an electric one. So you fill it up with water that's cold. It will heat it up, and then you can just tip it to pour. That you're not having to lift, which is really a nice option for people in terms of safety. There are also things like this that you can get for milk and juice and things like this, that all you have to do is the tipping. So sometimes that makes it just a little bit easier. I've had several people tell me that they love these. I have not personally used them, but these little things are Ziploc bag holders. So if you have to put things in Ziploc bags, you can clip them onto these and it holds the bag open for you so that you can pour in whatever you need. Some people find that to be a great thing, and they're pretty cheap. And then this was a pretty cool little device. It's actually an automatic pan stirrer. So if you're cooking something that needs to be stirred, you just basically at the press of a button, this little thing will rotate around your pan and stir whatever you need stirred. This is a bowl stabilizer. So if you find that you need a bowl held, it's basically kind of a sticky um, substance that holds that the item is made out of, and you set your bowl on top of it, and it will prevent it from sliding around on your counter. So for some people, cutting with the scissors is hard. This is a tabletop scissors. It's got a plastic base to it, and basically it stays put. You put your item in and then you just press down on the handle. So you don't need to make that full cutting motion that you would normally with a scissors. Nail care becomes more and more difficult. So this is one option. This is a one-handed nail cutter. So basically you put your thumb or your fingernail into that little slot and then you just come over top of it. I know that our podiatrist has recommended to a lot of people that they use nail grinders instead. But I would talk to your doctor about that and see what they recommend. Sometimes they do recommend going to somebody, but I'll tell you, getting fingernails trimmed is one thing that a lot of people find challenging. And then in terms of writing, sometimes again, with tremors, weighted pens can be helpful. This is a larger base pen, so it gives you a little bit more surface to grip, and sometimes that can be very helpful to people. This is called the pen again, and a lot of patients have also really liked this because basically you kind of slide your fingers into it, and it makes it just easier to stabilize for writing. And then when it comes to computer use, sometimes tracking balls, this is Logitech, and this is a wireless trackball. Sometimes that's easier to use than a mouse. When it comes to sleep, we know that sleep is really important for our health, and sometimes rolling in bed can become an issue. This is Comfort Linen has fitted sheets, and in the center of it is a smooth area that reduces friction, so that if you need to roll, it makes rolling easier. You can pair this also with their sleepwear that also helps to reduce that friction with rolling. And I'm just showing the nightgown, but they have several different varieties. So you can look online and go to Comfortline for that. And then for some people, having the weight of blankets on their feet makes it difficult and uncomfortable. So this is something that you can add to the bottom of your bed. It's a blanket lifter. And basically you put your blanket over top of it and it keeps the weight off of your feet, which is sometimes just helps with people in terms of their ability to sleep at night. And then, of course, with safety, we want to think about rails on the bed. And if we want to add them to our own bed, there are lots of options. This is just one that slips underneath the mattress, and then it gives you that handle that gives you the safety for helping yourself up out of bed. When we look at mobility, as I said, I'm an OT, not a PT, but there are options for this. And one thing I really like to point out is masking tape, because now it comes in so many different colors and there's so many different uses for it. So one thing that you can do if you find that you're freezing when you're changing floor surfaces or going through a doorway, that's where a lot of people end up having issues. Sometimes by simply having a piece of colored tape on the floor can give you a cue to step towards that piece of tape. And sometimes that helps with that freezing incident. You can also use it on steps and marking all sorts of things. This is a swivel seat, and we find these are particularly helpful in cars. Basically, you sit down on it and then it will turn with you so that it reduces again and makes it a little bit easier to get in and out of the car. And then we have found in therapy that laser pointers attached to canes and walkers, again, give that target for stepping forward. So the U-Step laser cane is one option. They also make a walker. And this one actually has not only the laser on it, but it also has hand brakes on it. So, and it's got the seat built in, but it also has a metronome. And for some people, that auditory cue also helps. And then the next stride laser is one that you can actually attach to your own cane so that you don't have to buy a new cane. It is still on the expensive side, but it may be covered if you have VA benefits. So that's what I have for you today. Does anybody have any questions for me?
Yeah, we've got a couple. So here's one.
Okay.
On a power wheelchair, is it possible to disable to a patient's joystick and only have the back attendant control for the caregiver to operate for dementia patients with atypical Parkinson's?
Absolutely, yes. You can definitely do that. I would contact whoever the vendor is that you got the chair from. And if you don't have a vendor name, have your doctor refer you to a physical therapist. Um, there are all sorts of things you can do with a power chair. I know at our hospital, one of the things that we really look at are pressure relief for people. Because, if we're sitting for long periods of time and we've got pressure on our bottom, we're more likely to get sores. So we can actually set up chairs that all they can do is take the chair and change it to tip the chair back, or recline the chair, so that they can get their pressure off of their bottom without being able to drive the chair at all. So you can definitely, there are lots of things that you can do to a power chair. So that's definitely a possibility.
Okay, and here was another question that was submitted when the person registered. I think we've got two of them here. For atypical Parkinsonism, for those patients with severe learning disorders like pizza syndrome, what specific or unique DME is available to keep them upright besides the typical contour-backed wheelchair seat and standard short hospital bed rails? Once we hoyer our loved one onto their hospital bed and they're sitting upright, they lean so much that it seems like they're going to fall out of their bed until we recline the bed fully backwards so that they're lying flat. Would full-length hospital rails help? Would a specific bed wedge for leaning help? They even lean in their contour-backed wheelchair if we poorly position them. We put rolled up towels under their elbows to help keep them upright. I'm open to any and all specific tools, advice, or guidance to help with this difficult learning symptom of a PSP-like patient. They're also very stiff from leaning and they hate being turned side to side in bed. So any tips or tools besides basic sliding sheets would be welcome. Do you have any experience with those pricier turning items for home use? Thanks.
Yeah,
That's a lot of
that is
questions.
that is a lot. So the first thing I would do is I would recommend that if they haven't, have them get a physical therapy evaluation for seating clinic. So the benefit to a seating clinic is that you're not only meeting with the physical therapist who is going to do measurements and look at range of motion and where there may be limitations with range, looking at their positioning. They have mapping systems where they can map out where they're getting the most pressure, and then looking at what activities, like how long are they in the chair and what kinds of things they're doing when they're in that wheelchair. And they can come up with some options. So you may have already done that, but sometimes it's worthwhile to do a second seating assessment, especially as people change over time. That would definitely be, because I know seating can be a real issue, especially when you have spasticity and other things that can really impact that seating. And you mentioned the stiffness. So we want to try and keep that person as comfortable as possible. We also want to make sure that we have some mechanism to relieve pressure. So we will usually recommend tilt and space chairs over recliners. And what that means is a tilt and space, if you can see my fingers there, it's making like an L shape. A tilt means that the whole chair will tip back, but that the seat angle stays the same. So the position the person is in doesn't change. Whereas recline means that the back will open up and it will be at a wider angle. And sometimes that can cause some shearing on their back, but it can also impact their positioning. Both have their advantages. So, for example, sometimes we need both. Sometimes we want to have somebody tilt because that is the best mechanism for them to relieve their pressure without really changing their position in the chair. But sometimes other people need the option of recline so that we can open up their back space and do things like catheterize or assist with clothing management. So both have their options, but that's definitely a reason to go for an evaluation for that seating and positioning. As far as the bed, you cannot just have those short rails on the bed. Sometimes you can get bilateral rails that are the full length ones. The problem with the full length is that if you are care providing, you're removing all the safety on that side. So sometimes it's nice to have a be able to change rails that you're lowering down half the rail and not the full rail. So I do like bilateral split rails where you have a portion at the top of the bed and a portion at the bottom of the bed, so that you have that full length. There are other things you can add to the bed, so you can add things, padding to the side. I know we have seizure pads that we put on beds all the time, so that if somebody has like a seizure, they have that. But you can use those also for positioning with what I'm hearing is leaning. Some beds also, there's all sorts of different electronic things you can do to beds. So, we have beds at the hospital that can change and put you into more of a chair position. And when it does that chair position, it's lowering your legs, but it's bringing you up into that seated position. You don't necessarily have to be up at a 90-degree angle. You can angle that back to still hold, use gravity a little bit to keep them in place. So I would strongly suggest getting some therapy for that person, because that does sound like, everybody needs a tweak every once in a while. And so if that person hasn't been in therapy for a while, that would probably be one of the best options to see what other kinds of devices are available for them. But I know how much of a challenge that can be caring for somebody like that.
Okay, next question. What is available to help with laptop keyboards?
Oh, there's lots of things for laptop keyboards. So, and there's lots of different devices available. So that would be one that I would strongly suggest going to the Maryland Technology Assistance Program, because they have all sorts of things that you can trial. And if you call their office, um, you know, uh, if you're able to get to their office, that's great, but they can give you all sorts of ideas. I don't typically use a lot of keyboards, but they do, and so they would be a great resource for you. And if you just Google Maryland Technology Assistance Program, it'll pop up.
Another one that I was going to ask, but actually you've already dealt with it, which is the laser cane. Somebody asked me about this several weeks ago, and I didn't have an answer, but you did. So
Yeah, and
so
that again, that's available at Maryland Technology Assistance Program too. I love that program because you can borrow things. And sometimes, what we recommend doesn't always necessarily work, but that's a way that you can try something and see if it's going to work for you before you go and invest money in it.
okay, that's all I've got. Does anybody have any other questions? No? Everybody's certain? Teresa, thank you so very much. This has been
Oh,
fascinating. Really,
Oh,
Jim,
really.
you're quite welcome.
hi there. Jim Smith did just raise a hand, so I
Oh,
can
okay.
actually
You want
let,
to read it? Because I don't see it, but
I'm gonna let Jim ask really quick. I'm gonna hit allow to talk. And then Jim, if you could unmute, you could ask.
This was really wonderful, and I was just wondering if there's some way that we could get back and look at this presentation. So, because I couldn't quickly uh,
yeah,
copy them all down.
so these presentations are all recorded, and you can just go to the MAPS website under events, and you'll see conversations with a doc, and you'll just scroll down, and you can see this anytime. You can see it multiple times if you want. So it'll be there, it'll be right there. Probably it'll be there by Friday. Michael, right, Michael? Friday?
That's right. That's right.
Okay,
Friday will be
Friday.
live.
I'm glad it was helpful for you, Jim.
It was fabulous.
Yeah, I thought so too. Teresa, you want to write an article for the newsletter?
Sure, you let me know what you need and I'm sure I can make something for you.
Okay, I will. I mean,
Reach out.
this has been I think this has just been really fascinating and helpful. I mean, some of it I just didn't know even existed, so it's great. It's
That
great.
and it changes every day. They add more and more things. It's always fascinating to me how much is really out there.
I can see.
Looks like
The
Jackie
toilet
has
thing,
her hand up too.
who?
It looks
Yeah,
like
Jackie.
Jackie has a hand up.
Yep,
Oh,
Jackie, if you could unmute, then you could ask a question.
I think I'm unmuted.
Yes,
Am
I
I?
hear you,
Yep.
Jackie.
Okay. Is there a resource somewhere where I can do a review of all the continents material, options there are, so you can,
You mean to do like a written review?
to do a what?
I guess I need clarification on your question.
Is there some place that presents all the options for continence services that you need as your body?
Oh, I can't think of one specific place because there's so many different issues with continence. So some people have, just
Right.
incontinence. Some people have
Right.
difficulty with urination. So I would start with your doctor and I would ask for a therapy assessment and they may be able to help you.
Would that be physical therapist or an occupational therapist?
It depends on what the issue is. If it's something with actual urination, that might be a physical therapist. There are both physical and occupational therapists that specifically work with urinary incontinence,
Okay.
and doing, exercises and things that may benefit that. But your doctor is the place to start with something like that. If it's a matter of being able to manage the incontinence issues, it might be physical therapy or it might be occupational therapy, or it might be both services. So, but a lot of times it's occupational therapy that will work on things like being able to wipe and being able to find ways to get more independent with those things.
Right, there are a lot of techniques they also have, and they have some, what am I gonna say, adaptations that,
Yes.
the people who use the different
Yeah, there's all sorts of
utensils.
adaptive equipment out there, from anything from being able to wipe yourself to suppository inserters. There's all sorts of devices out there. It's kind of amazing in terms of that area, what is available.
Well, it's very important, I think.
It
So,
sure is.
and so then the other side of it is some of the cleansing things that you can use. You're on your, not, I don't think you have to have a prescription or anything, but some of those things that are very
Yeah.
helpful.
There's little hand bidets that you can, if you don't have a bidet that's attached to your toilet, there are travel bidets and hand bidets that, where you just have water in a bottle that has like a spout on it that will direct the water. So there's
Yes.
all things available.
Okay, well, thank you.
You are quite welcome.
okay, I have two more questions. Is OT best to train a family caregiver on how to put on a Texas external catheter for a loved one overnight?
So sometimes it's a combination between nursing and a lot of times nursing is dealing with the catheters. If it is the person themselves that is trying to put that on, that may be a job for occupational therapy. So occupational therapists will work on things like being able to manage devices and sometimes doing those fine motor tasks and determine whether the patient is able to do that themselves. Or if there are other options, like that is where that quick change sometimes is a great option, and not using the catheter at all. Some men don't like having to, basically a Texas catheter is one that sticks to the penis, and then attaches to tubing so that they can just urinate and it'll go into a bag. But you have to be able to pull that off every morning, and some people don't like having that attached. So there are, ways to be able to work on that. And yes, I would be an occupational therapist that would be more than likely helping with that.
So this isn't a question so much as just information. www.gotdme.org is a national search tool via zip code to find lending libraries, if that helps anyone.
Oh, that's wonderful.
So
Yeah.
that's great to know. Thank you so much.
Yeah, there are actually lending libraries in every state. And they're a very much an underutilized service.
This has been just great. Any other questions from anybody?
Could we have
Questions,
the email
comments?
Could we have the email address from the last?
Sorry?
For the lending libraries,
Yes.
could you
Oh,
give that address again?
yeah, hold on. Let me see if I can find it. Hold on. Hold on. Oh my gosh, I don't know that I can find it.
Oh, I could
Yep,
give
I
you
got
that.
it. www.gotdme.org.
Thank you.
Michael, when we record this, when you put it on the website, can you put that down there too?
Yeah, I'll
As
put that
like as
in the
like
note.
a resource or something?
Yeah.
Okay, so that will be also on the website.
Great information.
Anything else? Well, everybody, Teresa, I can't tell you enough how great I think this was. So thank you, and everybody go enjoy your evening, and I would say enjoy your day tomorrow, but I don't think it's going to be sunny. I think we're going to have rain again. So I'm sure the plants
Oh
are
my.
happy. I'm getting sick of it,
Yeah.
but oh well,
Oh,
summer in Maryland. What can you do?
one more thing came through in the Q&A, and
Oh,
it was,
here it is. I see it. Ruby Well is also starting to help pay family caregivers who give care at home to Medicare recipients in certain states. And that website is www.rubywell.com. So there's another resource.
Great.
Nice to know.
I always love hearing about resources. There are
Yeah.
so many out there that we don't know about. That's why I always say you just have to put it out into the ether. And sometimes things come back that you never even knew existed.
That is true. That's very true. All right. Anything else from anybody? Okay, thank you very much. I'm not even going to ask anybody to fill out the evaluation. I've almost given up. But Michael, send it anyway, and maybe somebody will surprise us. Maybe one person, one or two people will fill it out and send it in. It really would help us if you would do that. So thank you very much, and good night. Thanks.
Thank you all for joining us tonight. I really appreciate being able to help you all out.
Thanks, Teresa.
Sure. Bye-bye.
Bye.